Does this medication cause frequent urination as a side effect? Before we dive in, a quick note. This video is for educational purposes only and isn't a substitute for professional medical advice. Always talk to your healthcare provider about your specific situation. Frequent urination is not a recognized direct side effect of Zepbound, though urinary changes may occur indirectly from other factors like dehydration or high blood sugar. Zepbound doesn't directly cause frequent urination, but if you're noticing changes in your bathroom habits, here's what you need to know. Let's start with how Zepbound actually works. It's a dual GIP and GLP-1 receptor agonist. That means it enhances insulin secretion, suppresses glucagon, slows down how fast your stomach empties, and reduces appetite. Unlike some diabetes medications called SGLT2 inhibitors that work by pushing glucose out through your urine, Zepbound operates through a completely different mechanism, so increased urination isn't a recognized direct side effect in clinical trials or FDA labeling. That said, some people do notice urinary changes while taking Zepbound. These are typically indirect effects, not the medication itself causing the issue. First, consider what else might be going on. If you're taking other medications alongside Zepbound, particularly SGLT2 inhibitors or diuretics, those could be the culprit. Caffeine and alcohol can also increase how often you need to go. It's important to understand the difference between urinary frequency and polyuria. Frequency means you're going to the bathroom often. Polyuria means you're actually producing large volumes of urine. If you're experiencing increased thirst along with frequent urination, that's something to pay attention to. These symptoms together can be warning signs of hyperglycemia, which is high blood sugar. If this happens, you should check your blood glucose levels and possibly ketones. If your blood glucose is consistently above 250 milligrams per deciliter, contact your healthcare provider. This combination of symptoms requires medical evaluation to make sure your diabetes is adequately controlled or to rule out other underlying conditions. Now let's talk about the side effects Zepbound does commonly cause. The most frequent ones are gastrointestinal. We're talking nausea, diarrhea, vomiting, constipation, and abdominal pain. These are the effects that showed up most often in clinical trials. There are also some serious adverse effects to be aware of. Zepbound can cause pancreatitis and gallbladder disease. It can also lead to acute kidney injury, particularly if you become dehydrated. This is especially important if you're experiencing significant gastrointestinal side effects like vomiting or diarrhea. Staying hydrated is crucial. One more thing about blood sugar. Low blood sugar can occur when Zepbound is used with insulin or sulfonylureas. If you're on these medications, ask your clinician if your regimen needs adjustment. Zepbound also carries an FDA boxed warning for thyroid C-cell tumors. The medication is contraindicated if you have a personal or family history of medullary thyroid carcinoma or a condition called MEN2. This is serious, so make sure your doctor knows your complete medical history before starting treatment. If you're managing urinary changes while on Zepbound, here's what you can do. Keep track of your symptoms. Note when they started, how often you're urinating, and whether you're also experiencing increased thirst. Monitor your blood glucose levels regularly, especially if you notice changes in urination. Stay well hydrated, particularly if you're dealing with gastrointestinal side effects. And review all your medications with your healthcare provider to identify any that might contribute to urinary frequency. When should you contact your doctor? Reach out if you have persistent changes in urination that don't resolve. If you're seeing signs of dehydration like dark urine, dizziness, or decreased urination despite drinking fluids, that's a red flag. Severe abdominal pain needs immediate attention because it could indicate pancreatitis or gallbladder disease. Remember, any new or concerning symptoms while taking Zepbound should be discussed with your healthcare provider. They can help determine whether the changes you're experiencing are related to the medication, another underlying condition, or a different medication you're taking. Never adjust your dose or stop taking Zepbound without medical guidance. Here's what to remember. Zepbound doesn't directly cause frequent urination as a recognized side effect. If you do experience urinary changes, they're likely indirect or related to other factors, and increased urination combined with excessive thirst may signal high blood sugar and requires checking your glucose levels. Always consult your healthcare professional for personalized medical advice about your treatment. They know your complete health picture and can guide you appropriately. Have you experienced any unexpected side effects while taking Zepbound? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.